Welcome. My name is Peter Strong. I'm a professional psychotherapist and I specialize in mindfulness therapy for the treatment of anxiety and depression. So if you're interested in learning more about mindfulness therapy for overcoming anxiety and depression, do please feel free to reach out to me and ask any questions you may have. And we can schedule an online therapy session at a time that works for you. People like online therapy. It's very convenient and it's also much more comfortable for most people to be able to have their therapy sessions at home or even in the office if they can find a quiet place for their online session. It's very important that you feel comfortable. I recommend that you also contact any therapist that you're interested in working with online before you schedule your online therapy session with them to make sure that their approach matches your needs. So I specialize in mindfulness therapy, which I find to be very, very effective for most people. This is an approach that teaches you how to work with difficult emotions using mindfulness. Now, mindfulness is simply a quality of presence, of being conscious, of being aware, of being able to form a relationship with your anxiety or depression without reacting, to be present with your emotions without reacting, without trying to push them away or run away from them, without trying to distract yourself, without any kind of reactivity, to be totally present. This quality of being totally present with your emotions is vital for allowing healing to happen. So painful emotions, emotional suffering in general, is always trying to heal. That's its nature. The mind is always trying to heal anxiety or depression in very much the same way that the body is always trying to heal any injury that it sustains. This process we call psychological homeostasis is very much the same as homeostasis in the body. So that's important to understand. Your anxiety or depression or other form of emotional suffering is already on a path of healing. The problem is that we do not allow it to heal properly because we become reactive. So in order for any emotion to heal, it must have that conscious presence that we're talking about in mindfulness therapy. That consciousness is what allows it to heal. It provides a safe space around the emotion that allows the emotion to change, to unfold or differentiate, to break up from being a very condensed, contracted state to being much more malleable. So emotional malleability is one of the results of establishing a mindful relationship with your emotions. They become more malleable and are more able to change, and it's through that change process that they heal. So we learn to become more conscious and more mindful with our emotional suffering. And we do this by meditating on our anxiety or depression. We make the emotion the central focus of our meditation to establish this healing relationship that allows the emotion to continue its path of healing. We can also help the emotion heal faster by interacting with it with compassion, helping the emotion heal by strengthening the relationship that we have with that emotion. So we treat the emotion very much as we might treat a person or a child or an animal that was in pain. We develop a conscious, caring, compassionate relationship with that emotion as an object, like a person or an animal. We cultivate that relationship, and that speeds up the healing process. We often find that what really seems to help build this relationship and facilitate healing is to explore the structure of the emotion itself. What is it that's keeping that anxiety or depression in place? And there's different parts to the structure. There's an internal structure and there is an external structure. The external structure is really mostly in the form of reactive thoughts. So the emotion takes form in reactive thoughts. For example, worry in the case of anxiety, or rumination in the case of depression. These reactive thoughts tend to feed the emotion, and that prevents it from healing. The internal structure of emotions is based mostly around imagery, the way that we see the emotion in the mind. So it will have a certain color, a position. It will have a size associated with it, a different texture. It may be hard or soft. It may be smooth or rough. The imagery is very, very important. That is what holds together the emotion. So thoughts feed the emotion, but the imagery holds it together and gives it form. So when we are meditating on our emotions, we are looking at its structure. We're looking for these reactive thoughts, first of all, the outer structure. When we see reactive thoughts, we do not react to them with further aversion or trying to push them away or trying to suppress those reactive thoughts. Instead, we respond to them with mindfulness in exactly the same manner. We learn to disengage from becoming identified with those reactive thoughts, and that is vital to allow the reactive thoughts that form this outer structure to heal and to resolve themselves and to extinguish themselves. We then move on to build this conscious, mindful relationship with the imagery of the emotion, and we let it change. If you stop reacting to that emotion, then it will begin to heal, and the way it heals is by changing its imagery. So the inner structure of emotions is based around this imagery, and as that imagery changes, so the emotion heals. So again, we can facilitate that by helping it change its imagery. We can try on different colors, we can move its position, we can make it smaller, we can move it further away from us, we can interact with it skillfully to facilitate its change. But the most important thing is to establish this conscious relationship, the mindful relationship, with that emotion that allows it to change according to its own internal healing process. So if you'd like to learn more about online therapy sessions using mindfulness, do please contact me and we can schedule an online therapy session via Skype. I use Skype because it's really very important that we can see each other, that is, I would say, the primary requirement for good communication, and that is certainly very important for good psychotherapy. So we use Skype, but we could also use FaceTime or other internet protocols that allow us to see each other. But I prefer Skype. I find that it works really well. So if you'd like to schedule a Skype therapy session with me and explore in more detail how we can use mindfulness to heal your anxiety or depression, then please reach out to me and let's schedule a session. Thank you.